All right, good afternoon. Before I start, I want to talk a little bit about the fact that our interpreter here is not wearing a face covering. We've gotten a lot of questions about that, and so I just wanted to clarify that is because of the lip reading. It's very important, and so that is by necessity, and we appreciate the service that you're providing to our community. I will make my remarks, then we'll hear from the mayor, then I will repeat in Spanish and we'll pass it on to Dr. Shah and Dr. Persse. As an update today, we've crossed 5,000 cases, reported cases between the city of Houston and the rest of Harris County. So within Harris County, at least 5,000 folks that have tested positive. We are reporting in Harris County outside of the city of Houston since yesterday, 41 new cases and 1 new death. You'll recall yesterday we also had cases to reports and deaths. We'll continue to keep you guys updated on this. Look, we are making progress as we've discussed, but they are digging mass graves in New York. They are going still through a very difficult time, and we're doing all that we are doing so that we never get there, and we continue to make progress. If we get cocky, we get sloppy, we get right back to where we started, and all of the sacrifices people have been making have been in vain. So as we see that hospital admissions curve flatten, let's not get complacent. Let's remember that we still have work to do. You guys have flattened that curve of hospital admissions. I shared with you guys yesterday. And we are hoping to be able to get out of this first phase at least very soon. But that is incumbent on that curve truly hitting a peak and actually coming down. And that is in everyone's hands, each one of you guys. We are also doing this so that we can get our economy open and keep it open once we do begin to lift the orders. If we were to open it right now, when those admission rates are not yet down, we would have to close it back up because we wouldn't have enough contact tracers, enough opportunities for folks to do their work and contain the virus, and it would be an issue for the hospitals. But that is all in our hands. That's why we're taking an additional action today and adding another tool to our toolbox. Today I'm signing an order requiring folks who absolutely have to go out in public to wear a face covering. We have to use every tool in the toolbox because if we get complacent, people die, the economy takes longer to recover, and those are the stakes. I'm heartened already by the number of folks who've been following the CDC guideline to wear face coverings. I've seen that, when I see folks outside. And let me explain briefly why. The latest research on this virus tells us that even if you are not symptomatic, you still could carry the virus. And so those particles, when you sneeze, when you cough, or even just close proximity to others, you could end up being a carrier and giving the virus to somebody else. And so face masks protect us against that transmission. So beginning on Monday, this coming Monday, and for the next 30 days, we are asking all residents in Harris County to do the following. Anyone 10 years or older should wear a face covering that covers your nose and mouth. Examples of what you can use: a homemade mask, a scarf, a bandana, handkerchief, whatever covers your nose and mouth. Of course, kids under 10 years of age, we encourage parents to have them use the mask. It's just, we know and we've heard it's difficult to have a kid younger than that age really keep it on, but we encourage folks to do that. The order will make exceptions, of course, for folks with health or mental health conditions that would be exacerbated by wearing a covering. It will make allowances for people exercising alone, for people driving, for people eating. Let me emphasize again, face coverings are not a substitute for social distancing. So we still have to continue to keep that distance from one another. And we are still under a stay home, work safe order. So we should not be out unless absolutely necessary. And if we do this, we will get that curve down to where it needs to be, to where we can actually begin reopening things and do so in a way that is sustainable. We've gotten questions from folks about where they should get a mask. To be clear, we are not asking people to wear a medical mask or an N95 mask. That's why the order refers to face coverings. You'll see I'm wearing a homemade one myself that someone gifted to me. Everyone has materials at home that they can use to make a mask. You could use an old t-shirt perhaps, a handkerchief, a bandana, or a scarf. You don't even have to make anything, just what you have that you can use to cover your nose and face. The idea, your nose and mouth. The idea is just to cover your nose and mouth. And we have instructions on Ready Harris right now on how you can make your own mask with just a t-shirt or a cloth that you have at home if you wish to make your own mask. I know this takes some getting used to, but these are all small yet powerful actions. The fact that we've all taken these actions together throughout our county is what's gotten us to this place. We've saved over 4,500 lives, according to Rice University. And this will continue to make a difference. This will allow us to hopefully get that curve to where it needs to get so we can begin opening our economy very soon and keep it open once we do. Each of you is a force multiplier in this effort. Things are looking good, they're looking up, but we have to keep at it. This is not about winning a game. This is about getting through the entire season, and we know we can do that. Let me close with a call to urge residents to get tested. If you feel you may have the virus, visit Ready Harris or call the number 832-927-7575 on Ready Harris. You will also see the resources for testing through the city of Houston, other counties, and surrounding governmental entities that are providing testing. Getting tested is not something to be scared of. It's a heroic act right now. If you think you have this virus, come see us. Folks who think they've been exposed are welcome. If you're a first responder, you'll be front of the line, and so we need folks to do that. Also a note, I know folks will be beginning the celebration of Ramadan very soon, and so the same ask as we always have. This is going to be a year in which we'll have to do things differently, and as we celebrate together, and as we practice, as folks practice their faith together, we have to make sure that we only see those that we already live with. This is not the time to be gathering with people who are not in our household. We've made too much progress to backtrack now, and so we'll continue to ask for people's support on that. So let me end it here. We'll hear from Mayor Turner, and then I'll repeat my remarks in Spanish, and we'll hear from Dr. Shah and Dr. Persse. Mayor Turner, thank you so much for your leadership and for being here.
Thank you, Judge, and thank you for your leadership, and it's good to be with you again here at TransStar. Just a quick report, the city of Houston is adding 27 new cases, 27 new cases today, and the good news is that we're not adding to the death count, so we will remain at 34. Let me just say this, and I'm sure Dr. Persse will elaborate. We're saying 27. But again, there may be some backlog in the system, and so the number may exponentially increase once that backlog comes through the system. So just a cautionary note. I don't want to get too comfortable in the numbers. The number that I do want to emphasize, though, is that for the third straight day in a row, we're not adding to the death count. So that number remains at 34. The other good news is that in looking at the reports that we get from the Texas Medical Center, the hospitals, there appear to be more discharges from the hospital than people who are in the hospitals, at least in many in those being treated for COVID-19. Let me just say that the evidence is clear. Wearing a face covering will help slow the spread of this coronavirus and can save lives. And wearing a face covering protects other people from you because you do not know if you are a carrier and can transmit the virus. You can be asymptomatic feeling great, feeling fine, but it doesn't mean that you're not infectious and that you cannot infect someone else. Most people will not know they are sick and will have no symptoms or only mild to moderate symptoms. But for those who are older and have underlying health issues, the coronavirus can cause severe illness and death. And let me underscore the fact of the 34 people that have died inside the city of Houston, all 34 died with underlying medical conditions. About 2 weeks ago, in fact, I was touring the Houston Food Bank. It was the first time that I put on a face covering, and I began wearing a face covering following the CDC's recommendations to wear one in a public setting. And this is especially so when you're around other people. It's one thing when you're by yourself, but when you're in public gatherings. I also instructed my staff and department directors to wear them while attending in-person meetings or working in the office. And during my daily news briefings, as you all very well know, I have encouraged Houstonians to wear face coverings even at home when they are surrounded by other people. Because the reality is we tell people to social distance, social separation. But if you grow up and if you live in a household like mine, where there were 8 and 9, 10, 11 people in a 2-bedroom house, and 2 bedrooms, a whole lot of people. When you say social distance, that was just a practical impossibility. Quite frankly, when there were 5 and 6 sleeping in the same bedroom, it was impossible to separate, so to speak. And so in those circumstances, wearing face coverings can be very helpful in dealing and coping with this virus. I also said that with regards to requiring facial coverings, that we wanted to get to the point where we would have a number of facial coverings, masks, you name it, to hand out and distribute. Tomorrow at City Hall, I will announce a plan to provide more than 70,000 face coverings to people in our vulnerable communities. And as Judge Hidalgo said, they don't have to be the fancy ones. We're talking about face coverings in general. The one I'm wearing was made by a grandmother. In fact, she made me several to try to match whatever outfit I am wearing today. I am a brown and a little bit of blue, and so this is a blue face covering. Yesterday I was adorned in black, and I had a black face covering. Tomorrow it may be, who knows, could be a purple day. I don't think I have a purple face covering, but it's all kinds. This one is different from this one here. And if by chance you don't have either one of those, I'll always carry a handkerchief, and that too will work. The notion is to cover your nose and your mouth and to keep from infecting someone else, especially if you're asymptomatic but find yourself infectious. And so tomorrow we will be announcing a plan to distribute a number of them. My daughter, Ashley Tamara Judge, is leading an effort with Lone Star Community College in Northwest Houston, where they're going to be handing out face coverings and sanitizers to other individuals in the community in these vulnerable communities. And many other people will be doing the same. So we can all participate, we can all do something. And one of the reasons why I am encouraging this, for people who use transit, the bus, light rail, you want to protect the drivers, you want to protect the passengers themselves. People need to use transit. It will be very helpful to put on a facial covering. And so those things are critically important. I also want everyone to know that information about cloth face coverings, including do-it-yourself, instructions are on the Houston Emergency site, and that is houstonemergency.org. We have also shared the information on social media, and I know Houstonians have been asked to make many shared sacrifices during the pandemic, and we don't want to stop now. And so let me just say in closing, a lot of sacrifices have been asked by people in our city and our county for the last 40 days. And people have been gracious enough to make many of those sacrifices. And I know people have become, they want this to pass. I know we all want it to pass, but April is a key month. April is a key month. And to the extent, by working together in collaboration, that we can continue to slow the growth of this virus, and in many ways, by working together, blunt it, and blunt it now, then the quicker we can return to some degree of normalcy. So thank you, Judge. Appreciate it.
Thank you, Judge. Thank you, Mayor. Really appreciate your comments. My name is Dr. Umair Shah. I'm the Executive Director, Harris County Public Health and the Health Authority for Harris County. I really want to just echo the words that you've heard from our elected leaders here with Judge Hidalgo and Mayor Turner, that really at the end of the day, we do recognize that we've done so much as a community. We've made so much progress as a community. Dr. Persse and I have been tied at the hip for weeks to months here. Really our two health departments really working together with our healthcare entities, doing everything we can to slow this virus down. And I want to thank our public. Everything that you have done to help us be able to do that has worked, and we are very happy about that. That said, we also recognize that as our community continues to move towards opening various sectors up, we do have the concerns that we want to make sure we do not backtrack at all when it comes to what's happening in our healthcare system. As we've talked about the number of cases, we still have testing constraints in the community. The number of cases gives us a breadth of how much transmission is happening, and we know it's imperfect, but we also recognize that hospitalizations gives us the depth and how serious those cases may be, or the infection may be in the community. And that's why as we move forward today, what we want to really work with our community on is what are the kinds of steps that they can take as we move into different phases. And this next phase includes the wearing of the facial cloth facial coverings, because at the end of the day, what we're trying to do is to say this is not in place of, in lieu of, instead of social distancing. This is in addition to. And this gives us the best chance that when I have a facial covering on and I am coughing or I'm sneezing or I'm doing anything, or even if I have no symptoms, because we know that a lot of this disease, unfortunately, is people without symptoms, that you can still transmit to the person in front of you, especially if you're within 6 feet. So this really is an opportunity for, if everyone's wearing those masks, that you protect each other and then you continue to keep that 6 feet social distance. So I want to make sure to make mention of that. I also want to make mention of the fact that we do recognize that this is a challenge in many communities, and I know both the judge and the mayor have spoken about this, and it's absolutely critical that it does not have to be a mask that is, in fact, we don't want it to be a medical grade mask. We don't want it to be a surgical mask. We don't want it to be an N95 mask. Those should be reserved for healthcare providers. This is a facial cloth covering, something that covers your face, covers the nose, the mouth, and it's snug enough that it allows for an opportunity for you not to transmit to others. The judge is absolutely correct that Ramadan is starting for many of our community members, and just as we spoke about with our Jewish community and our Christian community just over the last week or so with Passover and Good Friday and Easter, we want to make sure that our Muslim community is also taking heed of the message that we know this is a time that our community comes together, oftentimes with opening fasts or starting their fasts in the morning. We want to make sure that they do everything possible to, again, be emotionally, spiritually together, but physically apart. That is an absolute critical message for all of our community members, and we want to certainly recognize that. So the judge mentioned Ramadan, but I just was reminded that today is Earth Day. And I forgot that today is Earth Day because we've been doing so many activities, and there are a lot of disposable gloves and masks and other things that are out there, products that are out there. This is the time to remind our community to take those products and don't throw it on the ground. Don't litter. Don't ruin our community, please throw that in a garbage can and appropriately dispose of it if it's got something medical on it, obviously in a hazardous waste, depending on where we are. We want to make sure that we do not ruin the sanctity of our community. And with that, I just want to say thank you for everything you're doing. We're making progress. We want to continue to make that progress. We do not want to go backward. We can only do this with your help. Thank you, Dr. Persse.
Thank you, Dr. Shah, Judge, Mayor Turner. Thank you. One of the things that I would want to get across right now is in terms of the facial coverings and the importance of them. This virus is different from others. We've seen that. The phenomenon of asymptomatic or pre-symptomatic or minimally symptomatic spread is very real. A lot of pain and suffering, if you will. People have given up a lot. People have been out of work. A lot of work has been done already. And so it has benefited because as the mayor pointed out, and we've talked about numbers, probably from my standpoint, the most important number for us to be watching is the hospitalization numbers. Remember back in the beginning, we talked, this is about saving lives. And in order to save lives, we have to make sure that if somebody needs a hospital bed, that there is a hospital bed available for them. And as a community, because of the things that we have done, including wearing facial coverings and social distancing and not gathering in large groups, we have been actually quite successful in that. So the other thing is that we're now, within the city of Houston, we are now 3 days in a row with no additional deaths. And so the overall death count in this area compared to major urban areas across the nation is, per capita, is remarkably low. And that's because of the things that we have been doing. It's not in spite of, it is directly because of. And so Houstonians and folks in Southeast Texas need to be proud of what we've done. But as we move forward and we start talking about, there's talk about have we peaked yet? And I want people to think that, you know, the peak is not an event. It's not an occurrence. It's a phenomenon. And that phenomenon is when all of these things that we're doing as a community are equaling the force of the virus. We saw that this virus can be very forceful. It was in Wuhan. It was in New York. It has been in New Orleans. And if we give it an opportunity, it will be here. So as we move forward, for folks who want to get back to work and all of the other things we want to do, we have to remember the virus is not gone. It is still here. And if we give it an opportunity, it will take it. So measures like the judge's order and the things that we have been done under the leadership of the judge and the mayor have been largely very successful. So as we move forward, we need to keep up with these measures. And facial covering for people who are not ill is incredibly important. We know that Dr. Fauci had estimated that as much as 25 to 50% of the spread is from people with minimal or no symptoms. A recent article, scientific journal article out of China in one community where they went back and they did all the epidemiology, they talked to everyone who got ill. And 79% of those people did not remember being with somebody who was ill. Which means that in that community, when this was a large community, 79% of the spread of the virus came from people who did not have symptoms. And so any one of us could be spreading virus and not knowing it because you spread the virus before you get symptoms. And we know that some folks don't ever develop symptoms. And those folks are able to spread the virus. So the facial coverings are an incredibly important part of what we do. And so the issue of facial coverings not being something that everybody has in their pocket, the mayor tomorrow will be making distributing a large number of those. And we've got other entities that are distributing large numbers of those. But you know what, in your neighborhood, if you know somebody down the street who maybe they don't have the means to make a mask or make something and you've got a sewing machine at home, why don't you take a crack at it? It's not that hard. There are directions on the websites on how to do it. You know, and I'm the only one up here. I've got a little bit of, I know somebody in social media will point out that I'm the only one up here without a homemade mask on. And so guess what I'm doing tonight? This is not going to happen again because I'm not going to be the one. So I'm going to go home and yes, Dave is going to figure out some way to make a mask for himself just to prove that it can be done even by somebody my age and my dexterity. So The facial coverings are incredibly important. We're doing the right thing. Don't stop. Keep it up.